The US Surgeon General is America's doctor in a sense. He's got the ear of the president and deals with a huge array of issues, from the overall management of America's healthcare system to new technology, scientific advancements to reaching out to various communities. He's here in India now. Vice Admiral Murthy, thank you very much for speaking to us here at NDTV. You've written a lot in the last couple of years about mental health issues. It's something which is frequently not spoken about enough, perhaps not in the US and certainly not here in India. There is a clear link between social media use and potentially poor mental health outcomes. Is that your sense as well?
Well, my sense is that there is a connection between social media use among adolescents and mental health concerns. And it's one of the reasons why last year I issued an official Surgeon General's advisory from our office to focus on that connection and to say that we've got to do more to protect our children. But this is part of a broader effort to make mental health the priority that it needs to be. Many of our countries are struggling when it comes to mental health, with not only in many cases of depression, anxiety, and sadly suicide, but also with the terrible stigma around mental health that makes it hard to talk about in our families and makes it hard to ask for help. Fundamentally what we have to do is to see mental health for what it is, which is part of our overall health, no less important than our physical health, and something that should be treated with the urgency and importance that it deserves.
Do different communities in the US look at mental health issues differently? And do different generations look at mental health issues differently? And I ask this because the sense I often get is that older generations just very often don't want to refer to that, certainly here in India. Do you confront those challenges between generations and between different communities?
Well, certainly in the United States, we see differences, of course, generations, and of course, across communities as well. Older generations aren't always used to thinking about mental health or talking as openly about it, although there are many exceptions now increasingly. Younger generations in the United States are much more open in speaking about mental health challenges, but we also see differences culturally as well. You know, my family is originally from India, and in the Indian American community that I grew up in, we didn't talk about mental health. It was something that was seen as a source of shame. I remember at one point I had an uncle who sadly lost his life to suicide. And I remember just the sense of shame around the family about the fact that this happened to us. And you know, there was a concern about telling other people about this because of what they would think about the family. That kind of stigma, the message it sends to young people, to all people, is that these issues aren't okay to talk about. And so this is something that we all have to work to address. I want to, ultimately one day for us to be able to speak about mental health the same way we would a sprained ankle or heart disease, with the same amount of openness and consideration.
Dr. Murthy, you know, the Indian American community, the American Indian community is among the most incredible achievers, very high achievers. There's a lot of pressure on young people going into college, doing extremely well, getting great jobs, etc., etc. Therefore, do you believe that, you know, pressures on individuals are sometimes unrealistic, which may result and do result in poor mental health outcomes?
Well, I do think we have to take a look at those pressures and understand where they're coming from, but also how to mitigate and manage them. One of the things we know, for example, is that pressure is a lot easier to deal with. Stress in general is easier to deal with when we have social support around us, which is why the issue of loneliness and isolation being a broader epidemic in our country, the United States, but also around the world, why that is actually a real problem when it comes to mental health, because it, again, is a natural buffer for stress to have connections and loneliness. When you don't have that, it makes stress harder to manage. But I think we also have to ask ourselves, what are we doing to define success for young people in ways that actually help them? When I talk to young people in the United States, many of them feel that they're being asked to hustle after a definition of success that's largely centered around how much money you make, how much fame you can acquire, and how much power you can amass. And while there's nothing wrong with acquiring fame, fortune, or power, if we think that that is going to ultimately lead to fulfillment, long-term fulfillment for our kids, unfortunately, life experience tends to point us the other way. So if we really want our kids to be deeply fulfilled, the thing I think, need to increasingly think about is, and I'm thinking about this as a father myself, to be honest, who have two small kids, is how do we help them build a life that's focused on meaning, on purpose, on service, and on community? These are the building blocks, ultimately, of fulfillment that we all want for our children.
Doctor, I was going through some statistics, and the suicide rate in the United States for those between 10 and 19 years of age has jumped by 40% from 2001 to 2019. And visits to the emergency room have, because of self-inflicted injury, has gone up dramatically as well. Why has this been happening?
Well, this is one of the most painful consequences of the broader mental health challenge that we're facing. It's suicide. And as a parent, to think about losing your child to suicide, this is the deepest pain that a parent can go through. And I have sat with many parents, not just in the United States, but in other countries as well, who've lost children to suicide. And we've got to do something about this. Now, when we look at the United States, we've seen this significant increase over the last 2 decades. It's coming from not just one place, but from several places. Number one, we see that loneliness has become a profound issue among kids. It's an issue across the population, but it's hitting young people the hardest.
Is this an epidemic?
It is. I believe absolutely it is. But the other issue, in addition to loneliness, is we're seeing that that violence in many of our communities has actually not only impacted kids, but the fear of violence is quite significant. We have over 50% of kids in the United States are saying that they're worried about a shooting taking place in their school, for example. But there are other factors as well. They're constantly being surrounded by negativity, by negative news is hard. Kids actually tell us, they say their phones, which they carry in their pockets with them all the time, are constantly buzzing with negative headlines that make them feel that life is and the future are bleak. But finally, we have to consider the impact of technology itself and social media in particular, which is when we look at the data, we find that when adolescents are spending more than 3 hours a day using social media, they face double the risk of depression and anxiety. It's one of the many reasons we have to address the harms of social media.
And who does that besides government? What about the role of companies? There are technologies available which can actually restrict a user's use of a particular platform. There are pages which you can be blocked from getting onto, particularly if you're a person of a certain age, and yet there are always ways around this, and many companies don't want to actually discourage users. So is that a challenge that you face?
Well, look, I think we have a lot of challenges when it comes to managing these harms. And I think one of them has been, for the last 20 years that social media has been around, we have broadly failed as a society to ensure that they meet safety standards.
Yeah.
If you think about cars, for example, we ensure that cars have some basic level of safety in the United States, and in many other countries in the world do this too. And we do that so that when you get into a car, you don't have to check and inspect the brakes yourself and make sure the engine is sound and check the frame of the car to make sure it can withstand a crash. Those safety standards help protect drivers and passengers.
Sure.
We don't have anything like that in the United States when it comes to social media. No safety standards to fundamentally protect kids in particular. And so the entire burden of managing the harms, and those harms could be either a violent content or harmful content. It could be videos, and many kids are fed through the algorithm that encourage them to actually engage in self-harm. They could be addictive features that seek to lure the developing brains of kids into excessive use. But the entire burden of managing all of that has fallen on kids and parents.
Right.
And that is fundamentally not only unfair, but it's ineffective. And we see that in how this is manifesting today. So fundamentally, I do believe that companies have a responsibility to make their platforms safe. I think they also have a responsibility to share the data that they have about the impact of their platforms on the mental health of kids with the public. And right now, independent researchers say that they cannot get full access to that data. So for all the harms that we know exist right now with social media use and mental health of kids, there may be even more. That data transparency is vital.
What about legislation? Is there something that the US government would like to do to control social media use, or can it?
Well, in the United States, there actually is broad bipartisan interest across both major parties in making social media safer for kids. And we've actually seen legislation advancing in our Congress to do, in fact, that. Now, it hasn't gotten over the finish line yet, and that's why this push is still very important to ensure that we actually do have safety standards in place. But that's a place where government in the United States is really vital. And so I as Surgeon General, have met with legislators from both parties to encourage them to think about how we can, as quickly as possible, make social media safer for kids. The old strategy of, again, just leaving the entire responsibility for managing these harms up to parents is simply not working today.
Yeah. I just wanted to speak a little bit about vaccination. India has had a big role in vaccination, particularly during COVID. We've got a huge manufacturing base in India. Hopefully it'll never happen, but if there is another pandemic in the future of the proportion of COVID, do you believe India might have an important role in manufacturing vaccines for the world?
Well, I will just say this. Already today, India has a vital role in manufacturing vaccines for the world. There's no country that produces vaccines at the scale that India does, and that's important to the entire world. And this is also why the collaboration between the United States and India around vaccines is such a positive development. This is building on 4 years of collaboration between our National Institutes of Health and other parts of the US government with India. And that collaboration is going to be vital to ensuring that when new threats come, we can quickly develop vaccines, but we can also manufacture them at scale and distribute them. One of the challenges we saw during COVID was that process needed to be stronger, and we needed to be able to distribute vaccines in a way that we can ensure that all parts of the world had them so that there weren't inequities created by this pandemic. So these are all areas where we can do better, but I firmly believe that the partnership we have between the United States and India will be vital, not just for the next pandemic and not just for these two countries, but also for the entire world, because when India and the US build effective collaborations around vaccines, the entire world stands to benefit.
A final question. I was in the US a couple of weeks back. There was the Quad Summit which took place, and there was a huge announcement on a quad cancer moonshot is what it was called. It was for cervical cancer. It's something that affects millions of women across the Quad region. International cooperation in health is so important, but specifically this cervical cancer and protecting any number of women against this, how important an initiative was this?
Well, this is a vital initiative, and it's building on more than half a century of collaboration between our two countries on malaria, TB, HIV, dengue. There have been so many diseases where our countries have put the best and brightest minds together to find paths forward. And being able to do that now with cervical cancer is vital, because this is an illness that affects so many families across the world. And what we need to do better is screen people. We need to be able to administer the vaccine that can help prevent cervical cancer, the HPV vaccine. We need to be able to invest our best and brightest from a research perspective in developing treatments as well. And on all these fronts, the collaboration with our two countries can help us significantly advance the ball. And again, if we do this well, it stands to benefit many other countries which are struggling, again, with the suffering and the human cost of cervical cancer.
Vice Admiral, it's been wonderful speaking to you. Thank you very much for speaking to me.
Thanks so much, Vishnu.
Thank you very much.
I'm glad we did this.
Thank you.